to his little ankle joint. He's a little stiff. So we're just going to work those, you know, if you and I were stiff, just kind of work it out slowly until everything loosens up. Alright? And some of it he's also fighting me a little bit with it. So we're just going to work that. And we're going to go up to his knee. That's his knee. Just kind of working that, keeping those nice and loose.
It's like you're stressing me out.
And then we're going to do his hip. So just back.
Up. Yeah. And is there any such thing as going too far?
Well, I mean, you know, they don't lay like straight back,
Right.
so you know you can feel you'll feel the tightness. So it's just kind of, and then after we get all that nice and loose, we're just gonna do a bicycle, just like if you were walking.
Good boy. And how many times a day?
It's 2 to 3 times a day,
Okay.
5 to 10 minutes each side.
Okay, 5 to 10 minutes.
And then also after we finish all that, we're just wanting to stand, place his feet, if you have like a carpeted surface.
And there's lots of carpeted grandmas.
Yeah. And then just place, if this was carpeted.
Just to get
him
him used to.
Yep. Just supporting him. You know, you're gonna have a little bit of a hand under here, but we do want him to put weight on those. Ain't nobody is for slick. Just to support that as part of his physical
practice.
fitness. Yeah. Just to keep that and to support some of his weight.
So 10 minutes each side.
Yeah.
Can you just show me how you did the toes again? I just want to see like, what specifically.
Yeah, I'm just kind of
that's
just
the
like you and I
easiest
curling
one.
our
Yeah.
toes.
Okay, all right.
And then the hock.
Okay.
And if you lay on his side to do it, that's fine. Otherwise, he can lay in the lap.
Knee.
Knee.
Okay. And then the long.
Now, regardless of the movement, how much feeling does he have back there at this point? Is he feeling everything, you think?
I think he has feeling. I mean,
Okay.
if he's standing on his own, I'm pretty sure. I wasn't with Dr. Goodell when he did his physical exam on him this morning. I had another one of our guys. But I'm pretty sure that he's feeling his toes. So,
Okay.
you know, he is a little bit weaker. I think
That's
weaker
okay.
on the right than the left.
Okay. Is there anywhere we buy these sling things? I mean,
The pee pads?
oh, those are pee pads.
The sling,
Oh, I thought-
your
right,
sling's
yeah.
in your bag. That I'm sending you home with. That was part of, for you guys,
Okay.
for all the surgery and stuff. That
Thank you.
we do not charge you for those
Thank
slings. So, alright. So, he's still, you know, he's got some weakness, and that's gonna get better with time. Now, the palpating and the expressing. Like I said, he may pee some on his own, but we still want to palpate, make sure that he's doing everything. You can do this outside. And this one's really hard to teach off a video, so
Okay.
you're going to have to kind of learn it and then go through it. What you want to do is, and you can do it on both sides. Alright, just to kind of keep you from sliding, buddy. You're going to feel both sides of his sides in here, because his bladder fits right in here, behind his rib cage. You can do it one-handed, you can do it two-handed, and this isn't hurting him for me to put my hand right there, because I'm not really pushing down on anything. I'm just kind of using it to guide. He doesn't have much of a bladder right now, but what you're going to feel for is a little water balloon.
Okay.
And the longer he pees, the bigger that water balloon gets. And like I said, there's not much one right now. I don't even know, but there's enough for me to even teach you guys how to express, like to.
So we're kind of breastfeeding, but pee. You know, like pee.
Yep, and you can do it, you know, two hands. Boys, it's a little, you get peed on easier than girls.
Yeah.
So, but it's right up in here. You're gonna run your fingers back and forth, and I'm putting pretty good pressure in there. It's his bladder's right in here, but it's not very big. If you're running back, so you're feeling pretty.
That's a bladder. Okay.
It's some of that's bladder, not all of it, but if you guys can't get him expressed, because what you're going to do is you're going to find that bladder, and right now there's not enough in there.
Okay.
And then you're going to put consistent pressure.
But if it's really full, and it'll come out if we put pressure like that.
Well, it's consistent pressure. So once you find it, consistent pressure, let me shake both of your hands. It's a nice firm handshake like that. Okay. And it's not just about the full force of a one-time pressure.
Not your firm handshake.
It's a little bit lighter than mine. Yeah, but I mean, it's a nice solid handshake. And it's about finding it and just putting that pressure on there. And the bigger his bladder is, sometimes the less you have to, depending on how much he's fighting you with his abdominal muscles. It's just that nice, firm pressure. Yeah. Because what that does is it causes, there's a muscle in there, and it causes his sphincter release, which causes him to pee. Okay. It's not about just that one firm, full-time pressure. It's about consistent pressure, because that causes...
Like 5, 10, 20 seconds?
Usually. You know, it may take a little bit longer until you get a little bit better hang of it. If you guys can't get him expressed, you'll need to take him to your vet, bring him back here, or whatever's closest, to get somebody to express him for you.
About how long, roughly, will we need to do this? I mean, a week, 2 weeks?
Depending on how he heals.
Yeah.
You know, he had a urinary catheter in, so he may decide to pee a little bit on his own tonight, tomorrow, but we still need to make sure, because if he doesn't pee by tomorrow morning, he needs to go somewhere.
Okay.
That's really, you know, even late tonight, we hope that you get...
Late tonight.
Yeah.
Okay.
All right.
Has he been panting pretty